Having reviewed the situation carefully, we have assessed that it is time to step down the remaining measures in Singapore and establish an endemic COVID new norm.
I'm Chiao Suen. Thanks for joining us on ST Live. With Singapore's COVID-19 situation remaining stable in recent months, from this coming Monday, February 13th, Singapore will lower the Dorscon level from yellow to green. And so, community measures will also be lifted from the same date. Masks will no longer be required on public transport, and the same goes for indoor healthcare and residential care settings. But mask wearing will still be needed in patient-facing areas when there's face-to-face interactions with patients or when care is being delivered to them, such as in hospital wards, clinics and nursing homes. Health protocols will also be stood down. Medically vulnerable people with acute respiratory infection symptoms, as well as those with severe, prolonged or worsening ARI symptoms, are advised to see a doctor. And those with mild symptoms should stay at home. Also, the public can uninstall their Trace Together app, and there will be a Trace Together token return exercise from February 13th to March 12th at all community clubs and centres. For the migrant work community, from March, those with mild ARI symptoms may recover in their dormitory or see a doctor. Workers who test positive will not be needed to be conveyed to COVID-19 recovery facilities, and those with more serious symptoms will be conveyed to public healthcare institutions. The popular Places Pass, which was used to manage crowding in 4 designated locations, will be discontinued from next Monday as well. And all remaining border measures will be lifted, which means non-fully vaccinated inbound travellers will not need to show proof of a negative pre-departure test. And non-fully vaccinated short-term visitors need not purchase COVID-19 travel insurance. Subsidies and financing support for COVID-19 testing and treatment will also be adjusted to that of other acute illnesses. All patients, including Singapore citizens who visit a hospital or COVID-19 treatment facility for COVID-19 treatment, will no longer be accorded 100% subsidy. However, regular subsidies and safety nets like MediSave can still apply. And should you want to test for COVID-19 at primary care facilities, well, be prepared to pay the full fee, subject to prevailing subsidies. These will take effect from April. And if you haven't gotten your COVID-19 booster jabs yet, not to worry. For now, vaccinations and oral antivirals will remain fully subsidized for clinically eligible patients in outpatient, ambulatory settings of public hospitals and nursing homes until further notice. With the transition to Dorscon Green, the multi-ministry task force, which was convened in January 2020, will also stand down.
We will stand down the multi-ministry task force, and MOH will assume the management of the COVID situation as it does for other endemic diseases. We may have to reactivate community and border measures, and we may have to reactivate a multi-agency crisis management structure like the MTF. We hope this will not happen, but we have to be mentally prepared for such an eventuality, and if so, we seek everyone's support to rally together as we have done over the last 3 years. The journey to this point has not been easy. We've had many ups and downs. We've had to deal with many unexpected curveballs and surprises along the way. But we managed to reach this point together because we all did our part. So I thank all Singaporeans and everyone in Singapore for working together with the government and supporting one another through this crisis.
Our coverage continues on straitstimes.com, on Facebook as well as on YouTube. Don't forget to hit subscribe to stay informed and activate the bell icon on YouTube to catch live news updates. I'm Chiao Suen. Thank you for watching.